Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 5 NCLEX questions. Without delay, let's get started.
The nurse has assisted the physician at the bedside with insertion of a left subclavian triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services. A young adult is admitted to the emergency department after an automobile accident. The client has severe pain in the right chest where there was an impact on the steering wheel. Which is the primary client goal at this time? 1. Reduce the client's anxiety. 2. Maintain adequate oxygenation. 3. Decrease chest pain. 4. Maintain adequate circulating volume. The correct answer is 2. Blunt chest trauma may lead to respiratory failure, and maintenance of adequate oxygenation is a priority for the client. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. The primary healthcare provider prescribes 1,000 milliliters of Ringer's lactate intravenously over an 8-hour period for a 29-year-old prima gravida client at 16 weeks gestation with hyperemesis. The drip factor is 12 drops per milliliter. The nurse should administer the IV infusion at how many drops per minute? Blank drops per minute. The correct answer is 25 drops per minute. The formula is set up as 12 drops over 1 milliliter times 1,000 milliliter over 8 hours times 1 hour over 60 minutes. You multiply everything and you get 12,000 over 480. You divide 12,000 by 480 and you get 25 drops per minute.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.